Heart-related call-outs are very common. We can't predict what we might go to, but generally there are certain cases that we go to more than others, particularly chest pain. My name's Nicole Johnson. I'm a paramedic with Ambulance Tasmania. I've been a paramedic here in Launceston for just over 4 years now. I originally studied in Victoria, where I did a double degree in paramedic practice and public health promotion. I love being outdoors, I love getting out and about, and then the medical side of it as well. It's really rewarding being able to be there for people at a time where it might be the most scary time of their life. There's a typical day, but it's unpredictable. Generally we're pretty busy here in Lonnie. So we carry pages, which will get notified when we initially get a job. It'll give us a brief description about what's happened, so the age of the patient and a description of what they've called for. We often think about what the worst case scenario is and then can be relieved sometimes when we walk in and see a patient sitting upright and looking well. So our role in the ambulance is to start the process that involves medications that can slow the progression of a heart attack. Here in Ambulance Tasmania, fairly new to us is a Stemi pathway. So when somebody's having a heart attack, it allows us to transmit a picture of an ECG, a tracing of their electrical activity of the heart, and notify the hospital that we're going to so that they can start to get their resources prepared and allow the patient to get to where they need to go as quickly as possible. If somebody thinks that they've got the signs of a heart attack, such as chest pain, or they're feeling a new onset of dizziness, nausea, sweaty, or shortness of breath, then it's super important that they end up getting to hospital, and whether that be via ambulance or someone else driving them, that's the best 2 case scenarios. Often we'll go to people that have put it off for so long, so they get chest pain and they'll call us hours and hours later because they feel like they're wasting our time or they don't need an ambulance. But it's really important that if they're having any of those symptoms that they call an ambulance straight away.